We did an experiment where we took a bunch of highly hypnotizable people, had them come in first thing in the morning without eating breakfast, and put down a nasogastric tube so we could measure how much gastric acid they were secreting. And we had them eat imaginary meals. So for an hour, they'd be visiting their best restaurants in their imagination. And one woman who was very hypnotizable, she said after about a half an hour, she said, "Let's stop, I'm full." Just eating imaginary meals.
She's just imagining that she's consuming something.
She felt full.
It isn't about being perfect. It's about being better. Hello, my name is Dr. Stephanie Stima, and I host expert discussions with thought leaders in all facets of health, including nutrition, fitness, hormones, stress management, performance, recovery, longevity, health span, and energy production. On this show, we discuss complex science, but then we also alchemize it into actionable, everyday living. The ultimate goal with the show is to assist you in making informed decisions about your health and to catapult you into being the hero in your own life. Hello, my friends. Welcome to another episode of Better with Dr. Stephanie. It's me, your host, Dr. Stephanie Stima. And today I have a wonderful conversation on hypnosis, high performance, and grief, trauma, and stress. My guest today is Dr. David Spiegel. He serves as the Wilson Professor and Associate Chair of Psychiatry and Behavioral Sciences at Stanford University School of Medicine. He's the director for both the Center on Stress and Health and the Center for Integrative Medicine. Dr. Spiegel's contributions encompass 13 published books, 425 scientific journal articles, and 175 book chapters spanning hypnosis, psychosocial oncology, stress physiology, trauma, psychotherapy for stress, anxiety, and depression. He's also the co-founder and chief scientific officer for the revolutionary self-hypnosis app, Reverie. And as you might guess, we are talking all about hypnosis, not the entertainment where someone is dangling a watch telling you that you are getting sleepy, but actual clinical hypnosis. So we talk about what is clinical hypnosis, who is hypnotizable, and what is actually happening in the brain. So are children more hypnotizable than adults? What are some of the lived experiences that preclude someone from being more or less hypnotizable? And then we get into some of the clinical applications of hypnosis. So we talk about high performance. So if you're a muscle mommy and you want to be lifting in the gym and being able to decrease pain, or if you're someone who's dealing with a chronic pain syndrome, if you're a perimenopausal woman and you're noticing more stress, more sleep disturbances, more mood and affect, and more anxiety, this is going to be a conversation for you as well. Of course, we talk about ADHD and stopping things like compulsive eating and habits that we don't want to have, and how we can reframe some of the negative self-talk into positives. This is, in all transparency, I didn't know a lot about hypnosis leading up to this conversation, but in the study and prep, and then in the conversation with Dr. Spiegel himself, I learned so much, and you are going to as well. So please enjoy my conversation with Dr. David Spiegel. All right, Dr. David Spiegel, welcome to the Better Show. I am just thrilled to welcome you to the show today.
Thank you, Stephanie. I'm delighted to be here.
I don't know much, in the spirit of truth and, honesty, transparency. I don't know much about hypnosis other than studying your work. So I am assuming that most people, when they hear the word hypnosis, they might think of, pendants being swung at a show, you are getting sleepy, and then making people cluck like a chicken and doing things like that. But in studying your work and in prepping for the show, of course, I have learned that there is clinical hypnosis. And so maybe we can just start by, lay of the land. What is clinical hypnosis? How does this differ from, can we call it entertainment, or, kind of show horse hypnosis? What are we talking about with clinical hypnosis?
Well, I'm glad you came to me for that. Hypnosis is a naturally occurring state of highly focused attention. And it's actually the oldest Western conception of a psychotherapy. The first time a talking interaction between a doctor and a patient was thought to have therapeutic potential. Do you ever get so caught up in a good movie, Stephanie, that you forget you're watching a movie and you enter the imagined world?
All the time.
Hypnosis has been called believed in imagination. So, you're sitting in your living room or you're sitting in a theater, but you put that out of consciousness and you just absorb yourself completely in what you're focusing on. And later on, you may think about it and say, well, actually, I didn't like the ending that much or something. But at the time, you're just in it. And our brains have this wonderful capacity to really focus on something that's important. That's the absorption part of hypnosis. The second part is what we call dissociation. You put outside of conscious awareness things that would ordinarily be in consciousness. Now, we do that all the time, too. Right now, you're having sensations in parts of your body touching the chair you're sitting in, but hopefully you weren't even aware of that until I mentioned it. If you were, we could just stop the interview right now.
There's a separate problem that I have to write. Yeah.
And so there's absorption, dissociation. So you put out of awareness things that allow you to focus intently. And the third thing is the thing that scares people the most about the stage shows you're talking about, Stephanie. And that's what people used to call suggestibility, that I can make you cluck like a chicken and do anything you want. It isn't really that. It's cognitive flexibility. It's the capacity to change your mental set and try out being different. And so when the football coach is dancing like a ballerina, I don't like making fun of people, but there is an important message there, and that is you can just let go of your usual assumptions of who you are, what people expect of you, and just try out what it's like to be different. And as a psychiatrist and psychotherapist, I love that because that's a situation where people can really change in a hurry. They can do things they didn't think they could do. They can treat their body differently. They can stop smoking. They can manage pain. They can do a lot of things they never thought possible. So what scares people the most about hypnosis is actually the coolest thing about it, that you can really see what it feels like to be different. And in 10 minutes, you can feel better. And that's what we do on our app Reverie.
It's almost like a pattern interrupt. Right, because
Yes.
we have a certain framework, we have certain restrictions and filters and schemas that we operate in the world by, and hypnosis can be a portal to that pattern interrupt and to maybe shake up or rearrange some of the schemas or filters that we have about ourselves and our environment.
That's exactly right. So just like when you identify with a character in a movie and you start to feel what it would be like if you were her, for example, gee, what would it be like if I were living the life she's living? You can actually try out being a different person and seeing what it feels like. And you can do it in a hurry. And that's what's so exciting and surprising about hypnosis. One of the things I love the most is just how surprised the people are who use it. They just don't think they can do the things that they do. I had a social worker who was in one of our early experiments with Reverie. We were teaching her to stop smoking by focusing not on fighting cigarettes, but on respecting and protecting your body. Treat your body as if it were your baby. It has to take into it anything you put into it, even if it's damaged by it. And she said afterwards, I didn't even want to stop smoking. I was smoking for 25 years. Didn't bother me. My friends and I would get together and smoke. And the first time I tried it, I didn't like it. But the second time that night, I went home. I thought, for my body, smoking's a poison. I need my body to live. I owe my body respect and protection. I lit up a cigarette. I looked at it. I said, who needs this? I put it out. I haven't had a cigarette since. I can't believe it. My friends can't believe it. She said, this is some kind of crazy-ass voodoo shit. And I mean that in a good way.
Yeah.
But people surprise themselves at their ability to change. And that's what is so exciting about hypnosis.
Well, it's interesting. A lot of the women that I work with, either clinically or in an online setting, often will come to me for body composition changes. And I was telling you before we got started, lots of perimenopausal women come and find me because, myself, I'm in perimenopause, all these different things. And when we talk about weight loss and body composition changes, often the people who are the most successful will say, what was really the key for me was I had to become the person who would prioritize working out. I had to become the person who wanted to nourish her body. I had to become, before some of the physical changes happened, those changes happened in the mind where they would ask themselves, what would someone who had the body, the desired body composition or desired outcome, let's say weight loss or fat loss or whatever, how do those people behave? And then emulating that until the behavioral patterns set in, and then the outcome can be achieved through the changed behavior. So what you're talking about is very at least it reminds me of my community a lot, because I think that in order, if you want to make a change, it's not necessarily, especially if it's a physical change, you're not going to see changes immediately, but certainly there has to be changes mentally. There has to be changes in the way that you view behaviors and the behavioral outcomes that you're trying to follow in order to actualize the outcomes that you're seeking.
That's exactly right, Stephanie. And what you're describing is focusing on the process more than the outcome, on what would it feel like to be that kind of a woman and do that. I'll give you an example. Stanford has a fabulous women's swimming team. Many of the swimmers wind up in the Olympics. They're terrific. But the coach called me because he noticed that a lot of his swimmers were swimming better in practice than they were in meets. They were actually slower in meets. Now, you would normally think, you're all pumped up, it's important, you'll do it. But what we discovered was that instead of focusing on how they related to their bodies and helped their bodies to swim the best race they could, they were focusing on the women in the neighboring lanes. And competitive swimming is not a contact sport. It doesn't matter what the woman in the next lane is doing. What matters is what you're doing in your lane. So we had them use self-hypnosis to practice swimming your best race. How do you relate to your body? How do you breathe? How do you coordinate your arms and your legs? All the things that good swimmers know how to do and need to do. And when they did that, they were swimming their best race in the race, not in practice. So it's a matter of learning how to relate to your body, in this case, as the best possible woman swimmer you can be. And in the case that you're describing, how would you eat and exercise with respect for my body? And you can start feeling good about that the minute you start doing it. You don't have to wait till your weight is different or till your exercise tolerance is better. You hope that will happen. But the best way to change human behavior is intermittent positive reinforcement. It's to feel good about doing it before you even get the other outcome, and you can wear different clothing and things like that. So hypnosis is very helpful in focusing on what you're for and focusing what matters to become, as you point out, a different person.
Yeah, she says something very interesting. I just want to underline it for a moment, which is the positive aspect of change. I think that a lot of people think that in order for you to affect any type of change, that there needs to be some sort of taskmaster. In my case, it's like my inner critic that's telling me you're not good enough, smart enough, do more, do better, do all these different things. And I'm sure I'm not the only person that is affected with which is such a problem. Many high achievers are. Talk a little bit about why it is the positive slant or the positive focus that is more important for affecting long-term change.
Well, you don't look like the cruel taskmaster. You clearly encourage your listeners to give themselves credit for what they do. But, if you were a parent with a child, there are parents who just yell at their kids. And I was a soccer referee years ago for my kids. And there were some coaches that they were yelling at the kids, don't do that, don't do that. And I'm just thinking, I'd want to be off the field if I were a kid. But the good coaches were the ones that say, nice going, Judy, you really kicked that ball so well. And even if it went out of bounds, so what? That what you're doing is training people to affiliate with the kind of behavior that will make them better soccer players, healthier people. And it's something you're naturally drawn to do more of because you feel good when you do it. And if instead you're being criticized and telling yourself or other people are telling you you're lousy and you'll never make it and all this stuff, that's what'll happen. So it's better to have a strategy that immediately makes you feel good and keeps you going at it because you feel good every time you do it.
And as a mom of two kids playing competitive soccer, I also have to say that the refs take a beating. Unfortunately, the refs, and we don't have enough refs now because parents are screaming at them, coaches are screaming at them.
Oh, I couldn't believe it. I once had a game where there was an offside. They thought it was an offside kick, and the ball was ahead of the other player. But because the ball was ahead, the offensive player could get there. And so I said there was no offside. It was fine.
Yeah.
The parents had the kids on the other team sit down on the field and refuse to play because they were sure I was throwing the game,
Right.
So I know what you're talking about.
Nuts. Okay, so let's talk about, okay, so you mentioned absorption, disassociation, and cognitive flexibility or suggestibility as being
Right.
some of the three pillars that allow someone to enter the state of hypnosis. Let's talk a little bit about what's happening in the brain. And I know I've heard you talk on Andrew Huberman's show, his podcast, on some of the different areas of the brain. So let's talk a little bit about that. And then I'd love to talk about, and this will sort of lead me into who is able to be hypnotized versus not. So the hypnotizability of an
Sure.
individual and some of the factors that play into that.
Happy to do that. So there are three things that we've identified. What we do is we took high and low hypnotizable people and had them in conditions that involved using hypnosis or not, doing other things. And the things that characterized only the highly hypnotizable people and only in the hypnotic conditions were three things. The first one was that they turned down activity in a part of the brain called the dorsal anterior cingulate cortex. It's part of what we know as the salience network. It's the part of your brain that sets off an alarm. It's like the alarm system to your house. If you hear a loud noise, you turn your head, what's going on? That's the salience network, which does pattern matching and it's saying, wait, there's a mismatch here. There's something wrong. And so it's a protective fight or flight kind of portion in the brain. And what we find was activity in that area goes down when people go into hypnosis. And in fact, the degree to which people felt hypnotized was correlated 0.7, which is very high, with the reduction in activity in that region of the brain. The cingulate cortex is like the C in the middle of the bottom of your brain on its ends, and the front part is the salience network. And so it makes sense that if you want to really get absorbed in something, you've got to turn down the system that would distract you, would tell you, wait a minute, maybe you should be thinking about something else. And, that's kind of the network that some of the social media programs play on to distract you and say,
Right.
hey, wait a minute, there's another girl over there who's better looking than you are and all this stuff, or some kind of threat.
Or even just the fear
distracting.
porn. It's like fear porn all the time. It's like
Right,
the world's
right.
coming to an end, that this candidate said this candidate did that,
Right.
all of that
True,
kind of stuff.
True
Yeah.
doom scrolling, right.
Yeah,
And you
yeah.
just want to turn down the part of your brain that gets distracted by that. You're just saying, I don't care what else is going on. I want to focus on this. So that's absorption. The second is dissociation, putting outside of conscious awareness things would be in consciousness. So there are portions of the back of the brain that are involved in dissociative processes in the default mode network, posterior cingulate cortex, that allow you to just disconnect. And part of it is also mind-body connectedness. So hypnosis is very effective at controlling specific parts of the body. So, for example, we did an experiment where we took a bunch of highly hypnotizable people, had them come in first thing in the morning without eating breakfast, and put down a nasogastric tube so we could measure how much gastric acid they were secreting. And we had them eat imaginary meals. So for an hour, they'd be visiting their best restaurants in their imagination.
It's like Willy Wonka.
Right, exactly. And one woman who is very hypnotizable, she said after about a half an hour, she said, let's stop, I'm full. Just eating imaginary meals.
She's just imagining that she's consuming something.
She felt full. And so we found that they had an 89% increase in their gastric acid secretion just eating imaginary food. And then we had them do the opposite, to imagine they were on a desert island, anything pleasant except food or drink, and there was a 39% decrease in gastric acid secretion. So the brain is communicating through a part called the insula. There's connection between the executive control region, the prefrontal cortex, and the insula, which is a little island of tissue in the middle of the front of the brain that allows the brain to directly communicate to various parts of the body, and also manages interoception, how you feel, how full your stomach feels, for example. So it's an intensified brain-body connectedness that happens in hypnosis. And that helps understand why we control pain so well, because pain can be processed there as well and in the anterior cingulate cortex. And so you can change the way your brain reacts to pain signals through this prefrontal cortex insula pathway. And the third thing that happens is you have inverse connectivity between the prefrontal cortex, the executive control network, and the posterior cingulate, the default mode network. Now, that's the part of your brain when you're just sitting there thinking, you're not doing much, but you're thinking, I wonder what people think about me, or what kind of a person am I, or am I being what my mother told me I ought to be?
It's the
the sort of
masks we wear. It's like sort of the
right.
masks we wear
Uh,
in society. Yeah.
I call it the my fault mode network. It's the part of
Right. Oh,
when
that's
you're
great.
blaming
Yeah.
yourself for stuff
Yeah.
that you didn't do.
Yeah.
Trauma victims often blame themselves for events they didn't control. You'd rather feel guilty than helpless. And so the default mode network, it can help guide you, but it can also help restrict you. It can help keeping you from becoming who you might otherwise be. And the cool thing is that in hypnosis, when you're active in the frontal part of your brain, you're inhibiting activity in the default mode. So I call it self-suspension. You just say, let me try out being different. It's sort of like taking a mini vacation in your brain. You go somewhere else, you can feel that you're different. And that is, on the one hand, in the worst case example, why the football coach will dance like a ballerina in front of 500 drunken people in Las Vegas. But it's also why people can surprise themselves and how much better they can care for their body, how they can stop smoking, how they can eat better, how they can exercise more regularly, how they can focus more intently. And so it's an opportunity to try out being different and see what it feels like. We call it cognitive flexibility.
And so when we think about who is more, I don't want to use the word susceptible, but just for the lack of vernacular right now, like who is more susceptible to being hypnotized? When we think about these three verticals and the areas of the brain and let's say the inverse connectivity between the PFC and the posterior cingulate, is it individuals who, you asked me before, is someone who can get really enthralled in and involved in a movie? Is it someone who practices dissociation or has had to practice dissociation as an adaptive strategy, let's say, in their life and their lived experience? Like who is going to respond well to, and you mentioned like the dorsal ACC, like the salience network, right? Like that sort of conflict detector.
Right.
If someone has been on high alert, let's say their whole life, or maybe not their whole life, but there's been, maltreatment as a child or some type of, trauma in their past where that salience network might be firing at a higher frequency, does that make them easier or more difficult to put into that state of hypnosis in your clinical experience and expertise?
Well, very good questions. And the answer is, I'll start with the brain and then go to the experience part. But
Okay.
we took high and low hypnotizable individuals, put them in the scanner, didn't try to hypnotize them, just looked at the brain activity. And the high hypnotizables were the ones who had higher functional connectivity. So that means when one region is active, the other is, between the dorsolateral prefrontal cortex and the anterior cingulate. So people who could coordinate their level of arousal with what they decided to pay attention to were more hypnotizable. And that's part of the intensity of absorption, that you can lose yourself in it. And in fact, we found that hypnotizability is associated with higher levels of gamma aminobutyric acid, GABA, which is the major inhibitory neurotransmitter in the brain. And it's what benzodiazepines, anti-anxiety drugs, stimulate.
Yeah.
So you've got your own little pharmacy in your brain where and particularly highly hypnotizable people, where they can soothe themselves by inhibiting activity in that part of the brain. Now, how old are your kids, Stephanie?
14 and 12.
14 and 12. So they're a little past the peak period. They're starting to lose it. But when they were 8 or 9, they'd be outside playing and you'd call them in for dinner and they just didn't hear you. They were doing their thing. Work and play are all the same thing for kids.
Time is an abstract.
That's exactly right. And
Yes.
in a way, it's a shame we force them to grow up because it's such a lovely period of life. You just, they lose themselves in whatever they're doing. Like, so all 8-year-olds are in trances all the time. But as you go through adolescence, where your kids are now, they start to shift the balance between experiential, giving primacy to experience. I'm feeling it. I'm in it. It is what it is. To logic, to analyzing things, saying, could this be true? Why would this happen? And so it's called formal operations in psychology. Piaget called it that. As you begin to develop adult cognition, you begin to let go of some of the experiential focus and analyze things more. By the time you're in your early 20s, your hypnotizability is very fixed. Your hypnotizability is the same at 21 as it is at 46 or 50 years old. It's as stable as IQ over that time period. And so we find among adults that there are three overall categories. On Reverie, we have a hypnotizability test you can take in about 6 minutes, determine how hypnotizable you are. The most hypnotizable people we call the poets. They just lose themselves in movies and plays and are intensely absorbed easily. Their problem is not getting into hypnotic states, it's staying out of them. On the other extreme, we have what we call the researchers. They don't believe anything they haven't read. They're very logical. They don't cut anybody any slack about what they're telling them. And most of us are in the middle. We call them the diplomats, where they'll take a trip, they'll engage in the hypnotic experience, and then step back and reflect on it. So, roughly speaking, about 2/3, 75% of the population is at least somewhat hypnotizable. And of that group, about 20% are very hypnotizable. And hypnotizability doesn't change very much in adult life. So what my approach to using it clinically is with every subject I work with, and you can do this on Reverie too, is I test their hypnotizability, determine what type of hypnotic responsiveness they have, and then adjust my intervention to that style of responsiveness. So if you're very hypnotizable, I'll just say, here, do this. You'll feel different, because that's what happens. For people in the mid-range, it's more of a negotiation. You just sort of say, well, try it, see what it feels like. If you're worried about this, we'll adjust it and do it differently. For people who are not very hypnotizable, I just say, don't expect a lot of dramatic inner experiences, but you can still use the strategy we use, which is focusing on what you're for rather than fighting what you're against, to change. And they do too. So we find that high hypnotizables get there a little faster, but everybody can benefit from taking this kind of approach to problem solving.
And I think you've also talked about, I'm a diplomat on the Reverie app. I was taking the test and they told me I'm a diplomat. So kind of right in the middle of, it seems like, a little bit, asked me a couple questions. I was like, no, yes. Then it started giving my answers. There are other ways though. I know you've talked about the eye roll test, not when you're annoyed at someone, but certainly like eye positioning and whether you can see the iris versus the sclera. Can you talk a little bit about that, what that might indicate as well in terms of someone's hypnotizability?
Sure. The eye roll is something that my late father, a psychiatrist, who passed along the genetic illness of interest in hypnosis to me. Both my parents were psychiatrists and psychoanalysts, and they told me I was free to be any kind of psychiatrist I wanted to be. So
as long as it was a hypnotic,
right. So he noticed that when he had one patient who I actually saw him videotaping, who had hysterical seizures. She would suddenly, her eyes would roll up and she would start moving strangely. And they did EEGs and there was no seizure focus in her brain, but she had this kind of hysterical dissociation that would happen. And he noticed that when it started, her eyes would look way up in her head and she'd then close her eyelids and have one of these episodes. And he taught her to use self-hypnosis to control them, to bring it on, but modify it. So you can't tell people like that to stop it, but you can tell them to start it. And that's teaching them the path to controlling the symptom, which they did. The next Monday, he had a really rigid, obsessional lawyer in his office, very controlling, asking a million questions. And he noticed when he asked the guy, he would always have people look at a light in the ceiling and close their eyes, that when he did it, his eyes came down before he could close them. And there's a lot about changes in consciousness that have to do with changes in eyes and eye movement. For one thing, we close our eyes when we go to sleep. When we're dreaming, we have rapid eye movements, even with the eyes closed. So the parts of the brain that regulate arousal also manage the third, fourth, and sixth cranial nerves that manage eye movement. And so the periventricular gray matter, which is related to arousal, is right around where the eyes are. And we're very visually dominant creatures, unlike other animals that focus on smell or hearing. Vision is our thing. Mm-hmm. And the whole back of our brain is processing visual signals. So it makes sense that if you can disconnect lowering the eyelid from lowering the eyes, what you're asking someone to do when they look up and close their eyes is remain awake. So normally when we close our eyes, we're going to sleep. Remain awake, but focus inward. So be alert, but inwardly focused. And that's what you do with hypnosis. So he found that in general, there's a rough correlation between the ability to keep your eyes up while you close them and experience hypnosis. And so if you want a quick guess about how hypnotizable someone is, just ask them to look up and close their eyes. And if you see mostly sclera and not iris, the odds are they're going to be more hypnotizable. Now, the test is a more thorough measure of hypnotizability, but the eye roll is a good guess if you just want to get the idea.
Yeah. And so now if we understand what's happening in the brain, are there people with certain lived experiences that are more or less likely to be able to disassociate, to be able to have that cognitive flexibility or that ability to be, that absorption that we talked about? Is there certain clinical scenarios that maybe you've seen or pattern recognition? Like, this is the one thing about clinicians, right? We become excellent pattern recognizers.
You got it.
Is there certain, let's say, categories of lived experiences, men, male, female, black, white, where we are seeing maybe someone is more able to enact their dissociative skill because they've had to use it in the past as an adaptive strategy, let's say?
That's well put. There is a famous psychology and psychiatrist research couple, the Hilgards at Stanford, and Jack Hilgard developed one of the standard longer hypnotizability scales. Josie, his wife, wrote a book called Personality and Hypnosis, and she tried to address just those questions you're talking about, studying Stanford students, and she found two things in the backgrounds of students who turned out to be very hypnotizable. And one of them is exactly one of the things you're talking about, which is what she called imaginative involvements, that children who had multiple experiences of using their imagination, so parents who'd read them stories when they went to sleep every night, who just enjoyed getting lost in fantasy or reading books that stimulated their imagination, turned out to retain more hypnotizability by the time they got to college. That's the good news. The bad news is something else that you implied, and that is that children who were abused in one way or another, who if their parents used physical punishment or were sexually abused, also tended to be more hypnotizable because they needed it as a defense. And I had a patient who said, I would just go to a mountain meadow full of wildflowers when my father was abusing me. And so it's terribly sad, but it's a self-protective device to just say, he's got my body, but he hasn't got me.
Right. Well, a lot of women who are sexually abused also talk about that as well. It's like if they were rape victims or something like that, they often will describe, and I've had patients describe this to me in clinic, where they'll say, I was just there, but I wasn't there. It's like I was watching it happen, but I was watching whatever was happening to me.
Right. Dissociation can be a powerful defense and protection against the experience of acute trauma. And it's got some consequences later, but it is protective and a sensible thing to do. You don't want to get the full picture when you're in the middle of it and just trying to survive and get through it as well as you can. So that's right. But you can also use that therapeutically. I've had a number of women who were sexually abused as children or teenagers, and I had one woman who was chronically depressed. She just, could never quite snap out of it. She lived a reasonable life, but for 30 years, she was depressed, on meds, wasn't helping that much. Yeah. And I had her picture herself right after she had been abused. And I said, I want you to tell me one thing. And I want you to imagine you're your own mother. So you're her mother now looking at yourself as a child. So you're using the dissociation in a different way. And I said, just answer one question for me. Was this her fault? And she starts to cry and she said, I'm stroking her hair. I'm stroking her hair. And because very often abuse victims blame themselves for events they didn't control. You'd rather feel guilty than helpless. You think if I just replayed it differently, it would turn out differently. And she called me a week later and she said, Dr. Spiegel, my psychiatrist wants to know what you did to me because I'm not depressed anymore. And she said, my friends don't recognize me, because she was carrying this burden of blaming herself for an event that she could see that she clearly did not control.
Wow. You said something you said trauma is that you'd rather feel angry than helpless.
Guilty.
Is that
guilty than helpless.
Guilty than helpless.
You'd rather feel
that is so true. And it's interesting too, because I've heard it, when we're talking about hypnosis, we're talking about being dissociated, even though, let's say, the dissociation in this case that we're describing happened with maltreatment. It happened in a very traumatic fashion. And I've heard Jordan Peterson talk about this idea of exposure therapy. And he's described it with, women in midlife who all of a sudden become agoraphobic. They can't go into public places. They have anxiety attacks. Or I remember there's one, I was watching him lecture about, I think it was, I can't remember if it was male or female, but the patient had a absolute terror around elevators, like couldn't get near an elevator. So what they would do is they would just walk by an elevator, and then they would stand in front of an elevator, and then it's almost like he was inoculating this patient, like slowly, it's like this slowly exposing the patient to the fear, and then showing the patient that they're safe over time, and then almost rewriting the story as they're going through this exposure therapy. And as you're describing this, it sounds like hypnosis does the same thing, because you might ask, well, why would you want to dissociate if that is the maladaptive or the adaptive strategy at the time, but maybe, 10, 20, 30 years along, like the patient you were just describing, being dissociated all the time becomes more of a maladaptive strategy. But it sounds like the way that you're describing the therapy of hypnosis in a case like this trauma is that we bring you into that state of dissociation in order to rewrite the story and how you feel. If you change the paradigm, like if you're the mom, what would you say to her? I would stroke her hair. I would tell her she's safe. I would tell her I love her. All the things that you were just describing.
Right. But you're right. But you've put your finger on something very important: the issue of control. That is, people will dissociate when they're losing agency, when they're losing control. And that's the most terrifying thing about trauma. It's not pain or fear. It's being rendered into an object, that things happen to your body that you have no control over. And dissociation is the best you can do to let the situation get part of you, but not all of you. On the other hand, what you can do is teach people to use dissociation to master their fear and approach the problem, see it from a different point of view. So it becomes a strength, not a weakness. And the key thing about hypnosis is I've had people who had fears of getting in elevators, getting in scanners and things like that, to just see themselves as using dissociation to control the situation quickly, to see it from a different point of view. So I recently had a woman who was scared to death of being in an MRI scanner, and she needed it because she had a possible tumor in her neck and was very scared about what was going to happen. She wouldn't even get in an elevator to get up to the floor where the scanner was.
Right.
And I had her picture herself. What she liked to do is swim, and she liked water. So I said, okay, well, I want you to imagine yourself flowing in a raft down a river. So let your body feel comfortable, enjoy the water. And now imagine the raft turns into the yellow submarine, and you're in the yellow submarine flowing down the river with it and enjoying the trip. And I want you to picture the scanner as the yellow submarine that you're in, and you're going to enjoy it. If you want to get out, you can get out. And so people can, with hypnosis, picture doing something they then need to do and do it. And it's a matter of doing this sort of desensitization, but you can do it in a hurry because people in hypnosis can control their somatic reaction. And that's a big thing about dealing with stress. You start out not by addressing the stressor, but how your body is reacting to the stressor. So when you're scared of something, what do? Fight or flight. You tense your muscles, you start to sweat, your heart rate goes up.
Stop breathing. Yeah.
Right. And then what happens? You notice that and you think, oh my God, this must be even worse than I thought it was. So you get more anxious and your body reacts, and it's like a snowball rolling downhill. With hypnosis, you can start getting your body comfortable first and then deal with and face the problem. And so sometimes hypnosis can be very helpful in getting people through things like airplane phobias and phobias about medical procedures and things very quickly by controlling how your body reacts first and then dealing with the rest of the problem.
How is, and maybe it's just two different words that mean the same thing, but how is flow state different than being in a state of hypnosis? Because I hear flow state, it's like you're really engaged in something, time seems to bend, there's no linearity to it, and you're highly productive, and then you come out of it and you're like, oh, okay, like how is that different than being in a state of hypnosis?
It's very similar. I knew Chick sent me high, and we used to talk about this and how similar it was. I think hypnosis is a lot like flow. He called flow an autotelic experience. It's one that is self-reinforcing. So you do it just because it feels good to be doing it, not because you're trying to get to something else. And being hypnotized can be very much like that. You're just absorbed in the experience. You can enjoy it just for what it is. And so in many ways, I think a flow state is very much like being in a self-hypnotic state.
Yeah. Okay. I have maybe a different question. I'm sure that you might have some insight here. In the, modern age of social media, there's often, and we see this sort of happening at universities as well, where there's trigger warnings on social posts, there's safe spaces in universities, and it seems, when we're talking about a trigger warning, are we worried? And I can understand the intention behind it. We don't want people to be triggered or activated in some way, or to reenact or to bring back memories that may be displeasing for them. But does this bubble wrapping, well, I'll say, and walking on eggshells, right? Like at the risk of like possibly not being totally inclusive or not, incorporating everyone into the conversation. Is that making us more resilient or less resilient? And if so, why or why not?
I'm not a big fan of trigger warnings for several reasons. First of all, what it makes me think of is guns, and I don't like that. But secondly, it's sort of implying that you're not strong enough to deal with something that might threaten you, and that if there is no trigger warning, there's nothing you need to worry about. And so you had just talked about the fact that exposure therapy is a major way of treating phobias and the aftermath of trauma. Yeah. So it is not bad for you to be exposed to difficult situations. I mean, if you really don't want to be triggered by anything, don't ever listen to the news. Don't read the newspapers. Right. Come on. Right. Life is like that. Yeah. And particularly by the time kids get to college, they need to learn to deal with difficult situations. So this idea that you have to kind of coddle them and warn them this could be upsetting doesn't make any sense to me. If you're growing up, for younger children, yes, you want to protect them, but it doesn't make any sense to me, and it doesn't help. You've got to be able to face even difficult, frightening, upsetting, painful things. I mean, God knows, kids by the time they're 20 have watched 10,000 people get killed on television and in movies. It happens anyway. So it doesn't make any sense. But the other thing that worries me more is it creates an assumption that if there isn't a trigger warning coming, there's nothing to worry about. And for God's sake, we have these social media things that are teaching kids how to hang themselves, how to kill themselves. And children are dying because they're doing it. Yeah. That's a problem. And the problem is that you can be sure that the people who do that sadistic stuff are not providing trigger warnings first. Be careful, you might actually hang yourself, So that's a problem. That's something we got to do something about. And the trigger warnings ought to be against the people that are posting that stuff. We've got to do something about that. But sure, there are lots of upsetting things going on, but you grow and you mature as you learn how to deal with it, to put it into perspective, to find things you can do to make the world a safer and better place.
I couldn't agree with you more, Doc. I feel there is this resilience or lack of resilience in the social media and social platform kind of era now. And I feel, as a physical parallel, if you never squatted, let's say, because you had weak knees or you were scared that it might hurt your knees, well, the lack of squatting is not going to make your knees stronger. It's like now you have a lack of stimulus, right, to the knees. And we know that if we want to create strength in the body, particularly if you want, if we're talking about muscle hypertrophy, if we're kind of getting into that realm, you need to train the body in positions of vulnerability and weakness in order to grow that strength, explosive power, and, range of motion and mobility and all the things. So a physical parallel, I think, is really easy to understand. People are like, oh yeah, if I have weak knees, I should probably be squatting in order to strengthen my knees. And it's the same that is true in terms of what we're describing here. If there are difficult subjects that have many different sides to them, maybe you're a Democrat, maybe you're a Republican, maybe we're talking about a medical intervention or lack of or the right to do a medical intervention versus not, et cetera. there can be a lot of emotionality. There can be a lot of valid points on either side of the table, but our ability to sit and listen to these conversations, to find a solution, to collaborate and have empathy for the person across from you, I think is something that at least I see lacking. And I could certainly be biased as well because maybe I'm now looking for it, but I certainly see people just sort of live in their own echo chambers, and then they're not more willing to field questions and thoughts and philosophy from someone who has a different viewpoint from them.
You're exactly right. And it's why we're sunk in this terrible partisanship now where you can't even begin to think about what somebody who disagrees with you is thinking or saying. If you want to find a way to create a phobia, just avoid dealing with the thing you're afraid of. So what happens is, people who are afraid of crossing bridges or going up in elevators, avoid it. So what that means is, A, you're thinking the fact that I'm avoiding it means it must be really dangerous, right? Mm-hmm. And secondly, you don't create a store of memories of having done the thing you were afraid of and gotten through it just fine, which is what you have. And exposure is one of the major ways of treating it. So what you can do with hypnosis is picture yourself doing it and focus on, for example, when people tell me they're afraid of heights, I say, you know what? Gravity is your friend, not your enemy. It's rooting you to the place that you're standing on. It's not pulling you off the balcony. So focus on the way in which you can experience what you're afraid of and move beyond it, move through it. And trigger warning and avoidance is the worst way to deal with that.
Yeah, I couldn't agree more. Let's talk a little bit about a couple of clinical applications. So you mentioned, I want to talk about the swim team at Stanford and high performance. I would love for you to talk about how hypnosis can be. So you were talking about the specific example of the practice. They were doing better practice times and performance in the practice versus in their meets. Mm-hmm. How can we use hypnosis as a tool for performance? Let's say whether it's in the gym or you're a pickleball athlete, as I am a budding pickleball athlete. And how do we distinguish? And the other question I have around high performance is, how is it different from, how is hypnosis, if it is, how is it different from visualization? When we talk with high performance athletes, right before a game, right before a match, they're sort of running through, let's say the soccer game, they're running through like, oh, this opponent likes to dominate. They're on their right foot. They're going to do this. They're going to do that. And then they'll sort of slow time down. How can they kind of be successful in that moment? Is that what we're doing with hypnosis, or are those two different pathways and strategies that the brain is engaging in?
Yeah, I think when you visualize intently, you narrow your focus of attention, and you're creating a performance plan that is like what you want your body to do. To give you one example, that bastard Putin, among other things, determined that the Sochi Olympics a couple of years ago had to be in a place that had virtually no snow. And so the athletes were only able to do one practice run before the competition, which is really bad. And our ski team, like Michaela Schifrin, who is a fabulous skier, would go up to the top of the run, look up, close her eyes, and she literally did that. She did the eye roll, closed her eyes, and picture every move on the run all the way down. And she and Bode Miller and others did extremely well in that Olympics just by visualizing it. She said, it felt like I was doing it. And that is a kind of self-hypnosis that they were doing. So hypnosis allows you to be in control of your body and the imagery and plan what you're doing. And what athletes do, what Tiger Woods did with his golf game, he used hypnosis every day when he was playing. And you can do three things. You can plan in advance. You can say, here's how I want to do this swing, or here's how I want to make this run. So you're connecting. We say that neurons that fire together wire together. You're setting up pathways in your brain to do the run the way you want to do it. You can, if you want, go into the state, say, okay, I'm ready. My body is prepared. Open your eyes and do it. And the third thing is, once you've done it, do a little review in self-hypnosis. Picture what you did that you enjoyed, that felt good, what you did that you might do better the next time, so that you can take advantage of your recent experience of having done it to up your game even more.
Okay, so let's go back to soccer for a minute because you can tell I'm a soccer mom. Love everything soccer. So the last World Cup, we had Cristiano Ronaldo I can't remember what team he was playing, but he had a penalty kick. And my friend and colleague Kristen Holmes, she's the VP of performance at Whoop, which is a fitness band that you wear, and Ronaldo is associated with this
I
band.
got it.
So he's right before he's about to take the penalty kick, he's wearing the band. You can see him kind of taking in like he's taking in big breaths. He's talking to himself in Portuguese. He's saying a couple things to himself. Takes the penalty kick. The kick goes in. Scores the goal. All the things. But what was really interesting was the Whoop captured mechanistically or physiologically rather what was happening to him. So he was able to, he was running around for however many minutes it was before the PK. It was like whatever it was, 60 minutes, 70 minutes, doesn't matter at the time. But obviously, you're running around, high heart rate, all of that. He was able to bring his heart rate all the way down to what would be considered a resting heart rate in the moments right before he took the penalty kick, and then takes the penalty kick. You can see him see the ball go in the back of the net, and then the heart rate kind of shoots right back up again. Dopamine, up, all the excitement and stuff that happens after you shoot a penalty kick. The heart rate goes crazy. So this is my question to you here. So I found this fascinating. So I was texting Kristen. I was like, I can't believe you guys captured this. Is that a real-time example of someone who's able to self-hypnotize into that extreme state of focus that you've been talking about and maybe inner peace so that he's able to kind of execute on what needs to be done in the moment?
That's exactly right. Yesterday, I was at our MRI scanner, and we were scanning a subject, and she was being asked in hypnosis to get into a state of focus and comfort. And her respiratory rate cut in half. She was doing 12 breaths a minute. She was down to 7 breaths a minute. When we could see it, we're still analyzing the MRI field, but that's exactly what happened. And I happened to be in England this summer when the English team was in the playoffs for the World Championship. And there was a situation just like you described. And the guy it was a beautiful kick. It was right at the upper corner of the net, and it was the winning kick. He didn't even look at the goal. He didn't look at it. He said, I was manifesting what I knew I had to do and what I knew my body had to do. So it was between me and my right leg. That was it.
Yeah.
And so, the things you would think about is looking to, oh, here's what I have to do. He knew what he had to do. He was just helping his body do it. And it's that same experience of being in unison with your body and cooperating with it, not trying to force it to do something. And you're right. And that is a state of, in an odd way, relaxation, not hyperarousal, because you're in better control of your muscles and what your body's doing.
Yeah, that is wild to me because he still has to be sharp and focused, but he was able to bring down his heart rate to a point where he was able to, sort of have this inner landscape, let's say, of peace or of rest, even though we don't want him to be flaccid. We don't want him to be, too parasympathetic, right. But he was able to sort of bring down the excitement for that moment in order to deliver on the goods, let's say.
Well, if you think about it, I mean, the fight or flight reaction, you're pretty much tensing all of your muscles, right?
Yeah.
Everything. Yeah. But if you want to do a complex athletic feat, you want some of your muscles active, but not all of them, because that becomes nonspecific. You're just struggling. And so you want to be able to selectively choose which of your muscles are going to be really active and which of them aren't. And that means a kind of calm, not an over exertion of muscles that need to let the other ones do what they need to do.
One of the things that I certainly know Ronaldo, not even in the same stratosphere as him, but one of the things that I notice in the gym is when I must be in these self-hypnotic states because my perception of pain, and it's particularly with legs, I'm thinking of leg days, which are generally really grueling for me. Mm-hmm. There are some workouts that I can get into where it's almost like the only way I can describe it, and you can redirect me here if I'm not using the right language, but like my inner GPS, like my inner pain sensors are almost down, and I'm really able to get into the movement, continue to work hard, and I'm taking a lot of pride in, the work that I'm doing. And then I only sort of start to usually when I'm having like an okay session, I sort of know when I've reached my limit. And then there's some times where I work well past my limit. My pain tolerance has been, really pulled down, and I'm able to really work past what would be, physiologically normal for me. Is that another maybe example for all the ladies, all my muscle mommies who are listening who like to lift as well?
Yeah.
Is there a relationship there when we are able to get in that self-hypnotic state to reduce our interoception or our perception of pain?
You're absolutely right, Stephanie. And so muscle mommies, go for it. The strain in pain lies mainly in the brain. And there are two words that start with P in your description. One of them is pain. The other was pride. And so you were reinterpreting pain signals as things that could make you proud because you could transcend it.
Yeah.
And we have evidence we did a study with Stanford and measure the collective brain response to a series of shocks that were administered to the wrist. And we found that in the hypnosis condition, the students who were getting the shocks, the P100, the first component that occurs in the EEG within a tenth of a second after the stimuli, disappeared. So the brain was immediately shutting down the same signal that was coming in by focusing on the hand being cool in ice water, cool, tingling, and numb. The P300, 3/10 of a second later, which usually is big when you have a task to do or there's a surprising stimulus, was half as big as it was otherwise. So the brain can literally reduce the amount of pain you feel. So the strain and pain, it does really lie in the brain. And what troubles me deeply, Stephanie, is last year, 88,000 Americans died of opioid overdoses.
Yes.
And hypnosis has not yet succeeded in killing a single person. It just doesn't do it. And yet it's an incredibly effective analgesic. And the fact that people are getting addicted to opioids and not using their own brains to modulate the pain the way you do in the gym is, to me, a tragedy. And that's why we built Reverie. I want people to have a way accessible right in their smartphone to learn how to manage pain and manage stress, manage anxiety, manage fear. Those are things that people can learn to do, and they don't need to take addicting drugs to do it.
Yeah, in clinical practice, I would see a lot of pain, like complex pain management. I would see fibromyalgia. You'd see just like a lot of chronic, you'd see concussions, chronic pain from, car accidents and whatnot. And what I would often find, at least psychologically, was I would find a lot of these patients, not all of them, but many of them, especially if the pain syndrome they'd been dealing with it chronically, so for a long period of time, it almost integrated. They would start using possessives with the label of their diagnosis. They would say my fibromyalgia, my chronic pain. It would almost become a part of their identity.
Mm-hmm.
And things would happen to them because of their fibro, because of their whatever. And I wonder if using an app like Reverie, if it was available, and we can certainly talk about the app and some of the features, because I know that there is a fee for the app, but it's like, if you were to pay for, in-person clinical sessions, like it would be far north of what the Reverie app charges. But I wonder if someone with, when we're dealing with like car crashes, concussion, any type of chronic pain condition, especially if these individuals have the ability to self-hypnotize, what some of the prognosis and outcomes might be in that patient population.
We find, Stephanie, that for both acute and chronic pain, hypnosis can substantially reduce pain. So we did a randomized trial published in The Lancet, 241 people having injections into their arteries, arterial injections for chemoembolization in the liver or renal artery stenosis. And at the end of 2 hours, the hypnosis group had pain ratings of 2 out of 10. The group that was assigned to a friendly supportive nurse had pain ratings of 5 out of 10. The standard care group had pain ratings of 8 out of 10, and they were using twice as much opioids. They could push a button and get opioids in there.
Yeah.
The anxiety levels in the hypnosis group were 0 at 2 hours. I thought they had died or something. They were just fine. It was 5 with the nursing support and 7 with the standard care group. They got done, the hypnosis group got done 17 minutes faster than the other group. And so, if we published a randomized trial like that in the Lancet in acute surgical pain, only what we were doing was a drug instead of hypnosis, every hospital in the country would be using it now.
Right, exactly.
But no, people just can't believe that it's happening. We've done randomized trials for women with metastatic breast cancer. At the end of each group, we would teach them self-hypnosis to filter the hurt out of the pain, to feel their body cool, tingling, and numb, to not assume that the new pain meant there was a new metastasis. It just may be more of the pain. And by the end of a year, the treatment group had half the pain level that the control group did on the same and low amounts of medication. So absolutely, hypnosis should be. I had a lovely young woman who was pregnant, 7 months pregnant, had terrible lower back disease, and they implanted a nerve stimulator. It didn't work. Her pain was 7 out of 10 when she saw me. And as the baby grew, of course, the pain got worse. But she couldn't.
You got to deliver that baby. You still got to deliver the baby eventually.
Right.
Yeah.
Eventually. Yeah. And she couldn't take meds because she was pregnant. Her pain went down to 3. I had her imagine she was in a warm bath, which was what actually gave her relief. And that's a very effective hypnotic technique in which you get your brain into the same state that it's in when you actually are in a warm bath, only you can evoke the state in your brain with hypnosis without actually being in the warm bath. So her pain came down from 7 to 3, but she looked angry. And I said, "What's the matter?" She said, "Why in the hell are you the last doctor I got sent to instead of the first?"
Yeah.
And that's the problem, Stephanie. So we built Reverie. It's my legacy project to make available to anybody who wants it exercises, and they're interactive. So the exercise, it's not simply listen to a long recording. The whole thing takes only 7 to 10 minutes. And it's interactive. So I say, is the pain better? Are you feeling more tingling and numbness? If they say yes, we go on and reinforce that. If not, we do something else. We say, well, imagine you're leaving your body here and going somewhere else. So it's as much like being in the office with me as I could make it. And we're finding substantial reductions in pain that persist. So the people who get this are 30 to 40% reduced in pain on the same medications that they've been on or with less. And so Reverie, it's easy to find, Reveri. You can go to reverie.com. You can download it from the App Store or Google Play. The first week is free. So if you don't like it, you don't get charged anything. It's like $95 a year for if you want to subscribe for a year. So you're absolutely right. It's a hell of a lot less than coming to see me or any other clinician to help them with a problem like pain or stress. So I hope people will make the choice to try out using their brain first and not after they've gotten themselves addicted to a bunch of opioids.
And as you're describing that 7-month pregnant patient, I remember when I was pregnant with my children, even though it was a while ago now, there was hypnotic childbirth. And I remember sort of being like, what is that? I'll just get my midwife. So this is like I had my foot in the granola. Like I was like, I'm going to have the midwife. I want to have it at home in a water bath, but like hypnotic birthing. And like, that's just silly, Yeah.
Well,
never. But now I'm like, man, I wish I did. Yeah.
Yeah. My wife, Helen Blau, is a Baxter professor of stem cell biology at Stanford who has a new book out for kids called Stem Cells to the Rescue, actually, about how stem cells work.
Oh, I love that.
She gave birth. Our son was 10 pounds when he was born. We were doing hypnobirthing. Wow. And she said about halfway through a 10-hour labor, she said, "David, I teach pharmacology. There are drugs for this thing." And I said, just keep floating. You're floating in Lake Tahoe, cool, tingling, and numb. And Daniel came out fine, and she came out fine, and I had no pain at all. And our daughter, too, was born in like 4.5 hours, hypnosis as the anesthesia. And what's nice and what she felt and what most women throughout history have done is they were in control of the birth. When you have an epidural, you lose some control of what's happening. And oddly enough, pushing is not the whole deal. You've got to relax to let the baby out. And
100%.
so learning to do that complex maneuver and manage the discomfort in a way that you keep the focus on, I'm here doing the best I can to help my baby enter the world happily. And that's a positive thing. That's not a negative thing. And so women who do this that I've met feel proud that they were able to do it. So
I remember my midwife saying something like, the pain is there to bring you your baby. She was like, she was doing a little bit of the reframing.
Good.
Yeah.
That's good. But you're what I'd focus on is your mastery of it is your step to proving to your baby what a wonderful mother you are. That you're doing this in a way that helps launch the baby's life wonderfully. And so it gives the pain a different kind of meaning. We have a wonderful psychology professor at Stanford, Ali Crum, who does studies on mindset and shows that people.
I love her work.
Yeah, it's terrific that people who have the mindset. We've just published a study with cancer patients that chemotherapy side effects are evidence that the chemotherapy is working. So they're unpleasant. It's not fun, but they show you that the drugs are doing what they're supposed to be doing. And people who approached it that way, who were randomized to mindset, did much better emotionally in handling the treatment and the cancer.
So we have this internal pharmacy for pregnancy and labor, for sleep, for stress, for performance. My last question, and then we can talk maybe a touch more about the Rivery app, is ADHD. So we see this diagnosis a lot typically in boys, although girls can qualify for the diagnosis as well. Basically, the inability to hold attention. Would the Reverie app or self-hypnosis be appropriate? Especially, usually the time of diagnosis for ADHD is in a younger child. So maybe in that, you were asking me the age of my children before, and you said, like if it's 7 or 8, they're still in that state of wonder and awe. Mm-hmm. Is something like the Reverie app, is that applicable for children? If we have children who are having trouble focusing my children, my younger one in particular, always gets in trouble because he needs to move. Like, boys, they just need to move and do things. But the teacher's always like, he's always getting up and walking around and needs to go to the bathroom. It's just kind of needs to, he's just very very kinetic.
Right.
Kinesthetic. Yeah. Thank you.
Right.
Is something like the Reverie app, can we apply that for children? Can we apply it for something like even if an adult ADD, if they have, the adult version of that diagnosis, can we use the Reverie app or self-hypnosis for that?
Well, the Reverie app was designed for adults, not for kids, but there's really nothing in it that would be harmful for kids. I'd say if you're a parent, keep an eye on your kid using it and make sure that they're feeling fine and, kind of reoriented when they're done. Because sometimes kids they're kinetic enough that they'll stop halfway through, and I would rather they completed the exercise. So keep an eye on it. But, the nice thing about hypnosis is that the worst thing that happens is it doesn't work. Big deal. There's no side effects. So just keep an eye on them. But it is a language. That somatic, kinetic language is something that children naturally speak. They lose themselves in whatever they're doing. So hypnosis is a natural state for them. Now with ADHD, I would say on the mild to moderate range, hypnosis might help. For more severe ADHD, I think they have trouble attending serenely enough to be able to do it. But for those on the mild to moderate range, it might help them calm themselves and focus a little bit more consistently than they do otherwise. We have not done studies on Reverie with ADHD, so I don't know for sure, but that would be my clinical estimate.
Yeah, wonderful. And so the Reverie app, Reveri, this is available on the Apple Store or the App Store. If you're an iPhone user, it's Android available.
Yes,
as
it
well?
is. You go to Google Play and it's available there, or you can just go to www.reverie.com and you can download the app from the website as well. And the website has a lot of other information about user stories and how they've responded, questions answered, and it shows you the structure of the app and the types of problems that you can get help with. Pain, stress, insomnia, habit control, finding your focus, preparing yourself for work or for athletic performance.
Wonderful. I've learned so much just in the prep of this conversation and in talking to you. Thank you so much for your time today. And, in the world of, we'll say social media. I'm so happy to see something that is so evidence-based and reworking what it means to, to self-hypnotize and the science of hypnosis. So thank you so much for your time today, Doc.
You're welcome, Stephanie. I can see the hypnosis worked on you. You're doing great. So
Thank you.
thank you so much. Bye-bye.
Bye-bye.